I think the minimally invasive approach has, proven over the years to be a maximal type of benefit to the patient. And it starts with tissue trauma. The more dissection, the more stripping you have to do of muscle, bone, tendon, obviously the longer the recovery time. So now with the procedures we have where we can use small dilators to spread muscle rather than having to retract muscle off of the bone to cut the muscle and allow the muscle to fall back into place postoperatively, not only helps with postoperative pain, but also with long-term morbidity. The recovery time's quicker, there's less blood loss, and with quicker mobility, you can cut down on the secondary problems such as postoperative respiratory problems or blood clots and things like that. So there's both immediate and long-term benefits from this less invasive approach.
So let's just say, for example, you're going to operate on a knee, and in the old days, you would make an incision that might be 5 inches long. Now we do that through an incision that's an inch long. And we do it with small little holes where we use a TV screen and small instruments that are 4 or 5 millimeters and rebuild these ligaments through those kind of holes. In the shoulder, for example, you would get an incision that literally covered the front of your shoulder, whereas now we can make 3 puncture wounds and completely rebuild your ligaments in your shoulder, completely repair your rotator cuff, open the spaces up in case of bursitis or impingement syndrome, which is a common word, and do all of those without ever even thinking about opening it up. I haven't opened a shoulder for a rotator cuff repair or a bank heart repair, which is shoulder instability a lot of the young athletes can get, in probably 6 or 7 years.
Spine surgery has had sort of a reputation as, well, if once you have your back operated on, it's going to be many operations over the course of a lifetime. And to some extent that still remains true, but we have better approaches now so that our less invasive procedures, such as coming from the side of the spine called the lateral approach, has allowed us to do procedures with much less blood loss, much less morbidity, and actually quicker recovery. And as we've gotten more experienced in this, and we were the first in the community to start with the lateral approach here back in 2006, we've seen great strides nationally and internationally with this procedure and approach. So I think that's been a big benefit to patients. And the baseline problems, such as a herniated disc or lumbar spinal stenosis, we do procedures through small tubes now. We use the microscope almost on all our cases to provide better illumination and better magnification and, quite honestly, better outcomes. And I think the patients are the major benefit from this.